Shine counselor. We're very happy to have him. He's prepared. He's already done this at another facility down in Hingham, I believe. So he's all warmed up for us. I want to thank BCAM for being here to film it. There were many people that wanted to sign up and couldn't make this date, and so they're going to be able to see it replayed. And if you people don't get enough of Steve today, you'll be able to see it back on BCAM up until, I think, December 5th, when the open enrollment kind of closes up. But this is a great presentation. I'm glad you're all here. This is wonderful, the great turnout. And I will leave the floor to Steve Sion. He's our Shine counselor. Thank you. Thanks for coming.
You all set?
Welcome.
Okay. Good morning, and again, like Terry said, welcome to Braintree Senior Citizen Center. My name is Steve Sayan. I'm the Shine counselor. Just a little bit of background. All Shine counselors are volunteers. These are non-paid positions, so we're here for the community. I work in Braintree and also in Hingham, and Terry has contact information for me, so if you want an appointment with us, call the Senior Center and you can have an appointment. I'm here every other Tuesday from 12:30 to 3:30. Okay. Shine is a volunteer organization, and we're certified by the state of Massachusetts. We have to take roughly a 6-day in-residence hands-on course, which consists of lectures, lots of case studies, guest speakers. At the end of the course, we have to take a test, which is graded by the state, and you need an 80% to pass. And once you pass the test, you do anywhere between 8 to 20 hours of mentoring with another Shine counselor before you're allowed to go out on your own. Every year we are recertified. We have monthly meetings that we're required to attend to gain new knowledge. We've all had national COREs, state COREs, and local town COREs. Okay, just as a background. Okay, so today I'm going to cover Medicare. I gave everybody a package. Does everyone have a package? Okay, so that's what we call Medicare 101. So those of you that are on Medicare and have tried to read the book Medicare and You, this is that book compressed down to something you can readily understand. Okay, there's one limitation with the documentation you have right now, and that's 2021 data. That's not 2022. What's different is the pricing. So Medicare Part B is $148.50 a month right now. We don't know what it's going to be. Medicare hasn't even published the 2022 data. So this is a good package for a benchmark. Can everybody hear me? I'm sorry, I didn't ask that. Okay. So this is a good package for a benchmark. So the prices you see are going to go up possibly $5 or $6. So just understand that when you're looking through this thing. As we get more information through open enrollment, I'll make up new packages and you can come and get them. Like I said, you can schedule an appointment with me during the month of November and December. Open enrollment is from October 15th through December 7th. Now what open enrollment means is if you're in an existing Medicare Part D drug plan or a Medicare Advantage plan, this is your opportunity to change those plans. Okay. If you have A and B, you're set. Your B premiums are based on your income, and that's based 2 years back. So Social Security looks back 2 years on your federal tax return. So whatever that number is, that's the premium you're going to pay. In this guide, there is a Part B premium page that shows if you file your income taxes singular or married, based on that number, that's the premium you're going to pay. Medicare Part A is free as long as you've worked at least 40 quarters and contributed to Social Security. That equates to about 10 years. If you've paid less than 10 years into Social Security, you're going to have to pay some premium, and that's identified in the booklet. Okay, any questions so far? Is everybody on Medicare? Anybody new to Medicare? Just signing up? Okay. So for those folks that are going to sign up, you sign up for Part A and Part B. If you or your spouse or partner is currently working and you are covered by their insurance, you don't need to sign up for Medicare. Okay? There's a lot of stories that, well, my friend said that when I turn 65, if I don't sign up for Medicare, I'm going to get a penalty. That's not true. It's only true is if you are not working and not covered by someone's plan, okay? So that eliminates probably about 10% of the people that I talk to right off the bat. So if you or your spouse partner is covered by insurance, health insurance and drug plan, you don't need to sign up for Medicare, okay? Because you're going to end up paying that $148.50 whether you use it or not. As soon as you pull the trigger and sign up for Part B, you're going to get a bill from Social Security. Okay? When you sign up for Part A, you'll get a card, and when you sign up for Part B, you'll get another card with the same number on it with a different date. Okay? If you are taking Social Security at the time you retire, your Part B premium will come out of your Social Security check. It's automatic. If you're not, they'll send you a bill. Okay? If you sign up for Medicare Part A and Part B, Medicare only covers 80% of the cost. You go to the hospital, you're going to get a bill for 20%. You have three options on how to cover that 20%. You can do nothing. Say, well, I'm a fairly healthy person. I go to the doctors once a year. I'll pay the bill. The other two options is a Medigap plan, and that takes care of the 20%. That's why it's called Medigap. It takes care of that 20% gap. The other option is a Medicare Advantage plan, and they are completely different. So Medigap, if you want a Medigap plan, you purchase them individually through the company, and there are 7 of them in Massachusetts. And they are good anywhere in the United States by any provider that takes Medicare, original Medicare A and B. So if you're in California visiting grandkids and you need to have medical care, you go to the provider, you show them your Medicare card and your Medigap card, and you're covered. With Medicare Part A, there's a $1,485 deductible, and that is if you're in the hospital. Now, you have to be careful. When you go to the hospital, if you have day surgery and they say they're going to keep you overnight for observation, you do not pay the $1,485. That's only if you're admitted, and that's a big difference. If you are admitted, you start what's called a 60-day benefit period. So you go in the hospital, you're admitted, you're there for a week, and you come home. You've started that 60-day window on that first day of admission. If you go back into the hospital, anytime within that 60-day, the following 60-day period, you don't pay the $1,485 again. If you go back in the hospital and you're admitted 3 months later, you're out of the 60-day window, so now you start another benefit period and you pay the $1,485 again. So you can have multiple benefit periods within a year. Part B has a $203 deductible. Part B is what you call your doctors or your outpatients. Sometimes if you go to the doctors and they do a procedure on you, it's not 100% paid for. You're going to be liable for the extra money. Once you hit the $203 deductible, you pay nothing. There's no more deductibles, and that's a calendar basis, January 1st through December 31st. Any questions on that? Okay. So Medigap, you want to buy a Medigap policy. Depending upon your age, you have the choice of 3. If you turn 65 before January 1st, 2020, you can choose the 3rd supplement. The first supplement is called a core, which is a basic plan, which covers the 20%. Now, if you look in the package, you'll find Medigap providers, and you're going to see prices anywhere from $110 to whatever. They're all different, but what they cover by each company is a little bit different. They all cover the 20%, but some might throw in vision, some might throw in some dental, some might throw in some hearing, some might have extra perks. You don't know what they are until you call the company. Medigap plans, it's always open enrollment. What that means is if you get a core plan, which is the basic, and you go to your doctors and the doctor says, wow, you need a knee replacement, you can call the insurance company and say, hey, I'm having knee replacement next month, and I want to go up to the next level of insurance to take care of a deductible. You can do that. It's always open enrollment. So you go to the hospital, you have the surgery, you go through PT, all that stuff, you come home 2 months later, You call the insurance company back again and you say, drop me down to the lowest price premium again. Okay. Which one of these plans you pick is up to you. But typically I will ask clients, they say, well, I don't know if I want Medigap or Medicare Advantage. And I'll typically ask them, do you travel outside of your home state often? Do you go to, like I said, California to visit grandkids for a couple of months? Do you go to Florida for a couple of months? Okay. If the answer to that question is yes, and your health is such that you are concerned, a Medigap plan might be your right choice. With a Medigap plan, you need a standalone Part D Delta prescription drug plan. If you don't buy one of those plans, regardless if you take no medications or not, you have to get a plan. If you don't get a plan, you will get a penalty, which will stay with you for the rest of your life. And the penalty is based on the number of months you do not have a Part D plan. I had one client that didn't have a Part D plan for 48 months, and she was paying about $60 a month as a penalty for the rest of her life, on top of the drug premium and on top of the drug prices. Okay? We can help you navigate that. Okay? If you don't want a Medigap plan and you want an Advantage plan because you basically stay local and you're happy, you can select one of those. And there are two types. It's called an HMO, Health Maintenance Organization, excuse me, or PPO, Preferred Provider Organization. They're different. They're both network-based plans, but an HMO is very restrictive. You have to go where your doctor says you need referrals. Case in point, you go to the doctor, he said you need a knee operation, and he said, I'm going to send you to someplace. And you say, no, I want to go to a hospital in Boston. He'll say, nope, they're out of the network. You can go there, but you're going to own the whole bill. Preferred Provider Organization, you have flexibility of where you want to go. You can go in network or you can go out of network. The decision is yours, and you're going to pay appropriately, but it's a less costly factor. Medicare Advantage plans also come with prescription drug coverage. So once you sign up for a Medicare Advantage plan, as long as it has prescription drug coverage, you're covered. So you won't get a Part D penalty. And in the back of that handout, there's 15 pages of Medicare Advantage plans. The big issue you have to go through with Medicare Advantage is you need to find out that all your doctors take that plan. You have to do the legwork. Okay? It can be time consuming, it can be very frustrating, but once you've done that, you'll decide whether or not one or the other Advantage plan is right for you. Advantage plans are as cheap as $0 per month. They're a fee-for-service based plan. You pay every time you use it. If you don't use it, you pay nothing. You can buy them for different amounts per month, and what you're doing is reducing the out-of-pocket maximum you're going to pay and your deductible. Okay? So again, a Medigap plan is if you travel outside the state often, you want to be able to go wherever you want to go, and you like that freedom. Medicare Advantage is if you pretty much stay in your area and you're happy with your doctors and they're in the plan, that's a good plan for you. The decision is up to you. Okay. Based on the information in the booklet, you can get an idea of which way you want to go. Okay? Any questions on any of that? Okay. Drugs are very, very difficult. So if you want to have a drug search, like I said, this is open enrollment, October 15th through December 7th. We encourage everybody that has a Part D drug plan to have another drug search done because the premiums change every year and the cost of drugs change every year. We can do a drug search for you. You tell us what drugs you take. We'll find a plan that is the best one based on the premium cost and the drug cost. And you can sign up for it in the open enrollment period. Okay? You that are on a drug plan right now, you're going to get some type of letter from the drug provider. And he's going to tell you, as of January 2022, your premium is going to go from $15 a month to some dollars a month. That you should read that, understand that, and come in and see us or have a drug search done. we'll find out, yeah, okay, the plan is the best one based on the rate, and that's that. Or, hey, there's a cheaper one out there based on what you take. Now, all drugs are not created equally. And what that means is there's about 18 different drug plans out there. And the way the drug companies put their drugs into brackets is called tiers. So there are 5, tiers 1 through 5. Tiers 1 and 2 are cheaper generic drugs. Some are as cheap as $2 a month, and tier 2 is around $8 or $10 a month. Your drug plan is going to have a deductible. Tier 1 and tier 2 drugs do not count toward the deductible. Only tier 3, 4, and 5. So if you're taking insulins, eye drops, asthma inhalers, those are going to be more expensive. Again, all drug companies' tiers are not the same, and that's called a formulary. So if you take lisinopril, which is a blood pressure medication, and I'm just using this as an example, and drug company A said this is a tier 3 drug, and drug company 3 says it's a tier 2 drug, there's a big cost difference there. So when we do a drug search for you, we sort on best premium and best drug prices. There will be companies that have lower premium, but the drug price will be higher, and conversely. So this is going to give you the best of both worlds. Okay? Any questions? Wow, no questions. Easy group. Yes?
A question going back to Part B.
Yeah.
If you work, you don't have a Part B, and you're working and your employer gives you insurance, is that the same thing?
Yeah. As long as you have medical coverage, and it's called creditable drug coverage, so you get prescription drugs, you don't need Part B.
Okay.
Now, if you turn 65 and you say, I got to sign up for Medicare Part A, and you're still working, you don't have to. And the problem there is if you have a health savings account, an HSA account through your employer, you could suffer tax disadvantages if you sign up for Medicare Part A while you're still contributing to the HSA. So you need to talk to your HR or your benefits group about that. Yes, ma'am.
I have a question about the prescription. If you choose an inexpensive plan because you're not on that many pills and your physical health changes, can you change to a better plan?
Excellent question. So if you get a Part D drug plan, you can change once a year, and only this time of year during open enrollment. So let's say right now you take no drugs. You're fit as a fiddle, you take no drugs. You're going to buy the cheapest plan, which right now is $7.20 a month, even if you take nothing, and that's going to avert the penalty. Come March of next year, you go to the doctor and he said, well, you need to get this, 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 and this. You're going to have to get those through that drug company. If you take mail order, when we do a drug search, we'll put in up to 5 different pharmacies of your choice. Okay? And there are 3 different types of pharmacies: standard and network, out of network, and preferred. You always want to go to the preferred pharmacy. So what that means is, in the case of this woman who takes nothing, she goes to the doctors and they say, you need some such drug. You tell him to send it to whatever preferred pharmacy you have, CVS, Walmart, Walgreens, depends on what the drug plan shows, and you'll get the best price. The mail-order drug plans are for those folks that take blood pressure, cholesterol every day, every month, every year. And you get those on a 3-month supply, and those are the cheapest plans, cheapest way to get it. Yes?
I have one more question. The Good RX, can you tell me if it's good for every one of these plans?
Good RX is good for certain drugs, and you won't know that until you go to the pharmacy. So you go to the pharmacy and you hand them your Good RX card, they'll look it up and give you whatever the price is. But again, you should always go to a preferred pharmacy. And you won't know what that is unless we do a drug search and that pharmacy, says it's a preferred. Typically, CVS, Walgreens, Walmart are preferred pharmacies for a lot of different drug plans. Okay? Any other questions? Yes?
If you're under the Veterans Administration for prescription, you don't need a drug plan.
Correct. So, and thank you for bringing that up. If you are a federal employee, if you are a state employee, if you are a retired military, or in some cases, some communities, you want to check with those administrators to make sure you're getting the best. So because you can get Medicare and you're a retired military and you're getting TRICARE, you're not going to pretty much do any better with Medicare. If you're a retired postal employee, you got better coverage through the OPM office versus Medicare. The reason you need to make sure you're doing the right thing is once you opt out of a federal, state, or town plan, you can't go back into it. Okay? So your question about the veterans, you're a veteran, you go to the VA hospital for your drugs, you're fine. If you want to do something else, you can do that too. But if you're getting everything through the VA and you're happy, you're all set.
There are some drugs that you can't get from the VA.
Mm-hmm.
What do you do?
You can,
Out of pocket?
you can pay out of pocket, you can try GoodRx. There's a couple of different other plans you can look at. You can get a Part D plan just for that particular drug alone if it's, if it's worthwhile. And again, that depends on the premium and the drug cost.
Thank you.
Okay? Yes?
How when CVS came up with it?
I'm sorry?
CVS came up?
Yeah.
How are they rated as a provider?
Okay, so you're asking about a mail-order drug company. We don't particularly pay too much attention. Every drug company, every mail order has a star rating. I don't bother looking at them. I just look at the price point. If you get your drugs every 3 months and they're coming on time and you have no trouble, they work for you. Okay? We really don't pay a lot of attention to the star rating because I don't know what the criteria is for rating them. I've had mail order drugs now for 5 years, and I've had 4 different companies, and I've never had a problem. I go online, I have the doctor put the prescriptions in, I say what I want for my delivery cycle, I put my credit card in there, I do auto pay, and it's done. So it's only if you have an issue, which 9 out of 10 people that I've talked to don't have an issue with a drug company, the mail order people. Okay. Your local pharmacy is where your doctor is going to send the unique prescription, and you have them send it there, and you pay for it, and it's done. Okay? Any other questions? Okay. 3 questions I haven't got asked about yet. Medicare does not cover hearing, dental, and vision, except if it's based on an accident and it's medically necessary. So your dental, your vision, and your hearing is up to you. Okay? Vision and hearing can be covered on some Medigap plans and some Medicare Advantage plans. If you look at the sheet, the handout that I gave you on the Medicare Advantage plans, the last group of colored sheets, excuse me, in the right-hand column, it'll say extra benefits. So it'll say there's a little bit of a dental coverage, there's a little bit of a eye coverage, and there's a little bit of a hearing coverage. You need to investigate that very carefully with the company if you're going to sign up with them. Medigap plans, some plans for extra fee give you vision and hearing. Next year in Medicare Advantage, some of the plans are offering some dental. For Medigap, there's no dental. You need to get that on your own. And it's very expensive, and the benefit is very small. So you need to be very careful. Okay. Now that's nice information, huh? You work all these years and look what happens. Okay. Yes?
How about all these companies on TV advertising giving you the world? No premium cost.
You don't like seeing Joe Namath? Okay, those are Medicare Advantage plans. Now, the way Medicare Advantage works is Medicare, who owns A and B, they contract with all those companies, and they say, here, you manage it. We're out of the picture. So you still pay your Part B premium, but a Medicare Advantage plan, you pay for everything that you use. As I said earlier, if you don't use it, you don't pay for it. I have one. I changed this year. Okay, so far for me, it's working well. Okay, but it's up to you. So that's the dilemma that you're going to get into if you're not already in one or the other right now. If you're in one or the other and you're happy with it, you can stay with it. No one says you have to change. Okay? But yes, so every Medicare Advantage plan, they have different little things they'll say to you. So you can get this, and you can get that, and you can get this, and you can get that. Okay? You, as the consumer, have to decide what you want, and at what point you want to pay for it. So case in point, on a Medicare Advantage plan, this year, primary care physician is $10. You go to the doctor, you pay $10. You go to a specialist, it's $45. If you go in to the office and they say you need an MRI, that's $325. If you're admitted in the hospital, regardless of it's admitted or outpatient overnight observation, it's $325 for outpatient. For observation and for admission, it's $425 based on the plans. They all have very high deductibles, $6,000, $7,000 plus maximum out-of-pocket expenses of $7,000 to $10,000. What that means is once you've hit the maximum out-of-pocket expense, you pay nothing. But it all depends on your individual health. Yes?
I have a question. This 2021 Medigap Plans, there's 3 categories here. Supplement Core, New Medigap 1A, and Medigap 1. Can you explain that?
Okay, so the 3 different types of Medigap plans. There's Core, there's Sup 1, and Sup 1A. With the Core plan, you're paying the cheapest monthly rate, and you are responsible for the $1,485 Part A admittance and the $203 Part B annual deductible. If you turn 65 before January 1st, 2020, you can get Supplement 1, which takes care of both deductibles, the $1,485 and the $203. If you turn 65 after January 1st, 2020, you can only get Sup 1A, which takes care of the $1,485 admittance deductible. You still are responsible for the $203 Part B annual. That's the difference, the big top end difference. There are other small differences, but those are the reasons why people buy that. Okay? So again, it depends on your individual circumstance, what you want to do in either case. Any other questions? Yes?
I'm not feeling well, so I go to the VA.
Mm-hmm.
An ordinary person not feeling well, is he better off going to the hospital emergency room or urgent care? All these little stores that are.
Okay, so that depends on you. I can't give you that answer. Emergency room, you're going to pay an emergency room fee. Typically, when I've used urgent care, it's with my practice. So I just get charged the normal doctor rate.
I don't follow you.
So my practice is over in Weymouth. That's where I go. So they have an urgent care facility.
Oh, okay.
I go to urgent care, I get charged the $10 doctor. Okay? If I go to an urgent care in the middle of town, I don't know who they're affiliated with. My assumption is you're only going to pay the 10, but I wouldn't take that to the bank. I would ask. But emergency room, you're going to pay an emergency room fee, period. You walk through the door, you're going to pay whatever that fee is before they even stick a needle in you.
Good question.
Yeah.
You talked about the enrollment on October 15th. Suppose you didn't have Part B and it was like June and you quit your job, you got fired. Do you call Social Security?
Yes.
To get on Part B
Yeah.
right away?
Like I said, as long as you're working and you have medical coverage and drug coverage, you're out of this enrollment period. This is only for people that have a Part D drug plan or have an Advantage plan and they want to change it for next year. So if you don't fall into that box, don't worry about it. So you retire next June, you come and see us in March. We'll give you the paperwork to fill out for Part B. We'll give you this booklet with updated numbers, and you can say, oh, I want to do this or that, and you just do it. You're fine. Typically, when you're 65, when you turn 65, you can sign up for Medicare 3 months before, the month of your 65th birthday, or 3 months after. That's the window. When you do get your Medicare Part A and Part B card with a date on it, you have 2 months to get a drug plan. But Most people, when they're getting ready to turn 65 and retire or getting ready to go on Medicare, they come and see us and we give you all this information anyway. So you're pre-armed so you don't have a problem. Yes, ma'am?
So this is just open enrollment. What if your insurance coverage is ending? I'm gonna give you an example. It's my husband. His insurance coverage will end on March 30th of 2022.
Okay. Is he retiring?
He retired, but the way he works, his union works, is he works 6 months and gets the next 6 months of insurance.
Okay.
So he's already worked for that 6 months.
Okay,
period,
so he has-
even though he's not working.
He has health insurance and drug coverage till the end of March.
Yes.
Okay, so he needs to sign up for Medicare effective 1 April
April
1st, 2022.
2022.
Yep.
And so he signs up for, because I already signed him up for Medicare A, because I was told I had to, but I didn't do Medicare B.
Okay, you don't want to do B until you absolutely have to, because as I said, you're going to pay for B. As soon as you say, I want it, you're going to pay for it.
So if I sign him up on April 1st, he will be covered effective April 1st.
You want to make sure that he signed up the first day of the month that he retires. So if his medical coverage ends March 31st, you sign him up for Part B effective April 1st. That way there's no lapse in coverage.
But he retired already.
But he's still getting medical coverage
Correct.
until
March
that
30th.
that point. He's fine,
Okay.
okay? He's fine. Now, depending upon your age and what you're going to do, you're going to have a problem. If you're not eligible for Medicare at this point, you're going to have to find
Right.
insurance.
So I'm just,
Okay.
I'll go under my own plan.
So you are employed
Yes.
and you have health coverage?
Yeah. Unto him.
Oh, you're under him. So you're going to lose it. You're going to lose it at the same time.
Yes.
Okay. So if you're under 65, not eligible for Medicare, you're going to have to get some type of coverage. You can go through the Massachusetts Health Connector,
Or through work.
or if your employer has it and you can get it, you might have to sign up during their open enrollment period. I don't know.
She said there was a special enrollment period for a situation. like
Okay.
that.
Okay. So yeah, you'll be all set. Okay. Yeah. Yes.
So, if I would, say I'm gonna plan on retiring in, the first week in May,
Uh-huh.
the ideal time for me to sign up would be in April?
You'd want to sign up. It typically takes, do you have Medicare A and B now?
No.
You have-
I'm still working, I'm still insured.
You're still working, okay. It typically takes about, you want to give it about a month.
Uh-huh.
So if you're going to retire the end of April, effective date 1 May, you probably put your paperwork in the beginning of April.
Okay, so at least a month.
I would go at least a month. Before the pandemic, it used to be like 3 weeks. When I did my wife 4 years ago, it was 3 weeks to get a B.
Yeah.
Where you can't really get Social Security, is hard to get into. I know the Quincy office has a drop box. I've been told that. So if you fill out your Part A and B paperwork, you put it in the box, they'll turn it around.
Oh, okay.
Yeah. And then you can, once you get your Part B, you can look at a drug plan, decide whether you want a Medigap or a Medicare Advantage or nothing. But you've got plenty of time. I like people to plan 3 or 4 months out.
Yeah, that's what I'm thinking.
Yeah, yeah. Yes?
So if he applies on April 1st, he'll be covered April 1st.
No. So when's his retirement date? April 1st?
He retired in May,
When's his benefit stop?
March 30th,
March 30th.
2022.
Okay. So you want to apply for Part A and B effective 1 April.
So at what point do I apply?
I would go a month before.
So a month before April 1st?
Yeah.
Okay.
So end of February, early March.
And we've also received some form that his employer had to fill out saying that
Yes,
he's covered.
yes.
So is that something we need to do now and send in?
Nope. You do that. So if you're going to apply March 1st, have them get to his employee the middle of February just so they got it.
Yeah.
And there's 2 pages. One is his basic name, address.
I have
The
it.
second, yeah, you have the forms?
Okay.
Okay. The second one is the one you need to take to his office, and they'll fill out, he had medical coverage from this date to this date, and you want Medicare to start the day after whatever date is on there. Okay? And that goes to Social Security. Anything else? Yes?
Question,
The Dunkin' Donuts hole. Okay, donut hole is at best confusing. So basically what it means is you take prescription drugs that are very expensive and you reach the limit of the plan. Okay, now when you go into the donut hole, your cost decreases a little bit and the drug cost sharing goes up. When you reach the maximum of the donut hole, you come out of it and your costs go down yet again. This is only applicable for folks that take chemotherapy drug, very, very expensive drugs. Okay? Most people never even get to the donut hole because, like I said, tier 1 and tier 2 drugs are not counted toward your drug deductible. Tier 3, 4, and 5 are, but again, most people aren't on those except for the occasional, like I take an inhaler, it's $250. So that goes against my deductible, but I'll never get into the donut hole. Okay? Yes, ma'am.
I'm oftentimes asked questions about the expensive drug of Eliquis. It's a blood thinning for people that have AFib. And it can be as high as $450, $500 to me. I've had that problem at the pharmacy. So is that something that would get somebody into a donut hole? I mean,
That could get you into the donut hole. Yep, it depended upon how much you take of it. There are some state aid programs out there that one of them is called Prescription Advantage, and it is income-based. So depending upon your individual income, you might get a benefit from that. Another way to possibly offset those high drug prices is talk to your physician. In most cases, well, I won't say in most cases. In some cases, your physician may say, well, a generic might work for you. I have clients that only take name brand drugs because that's what they require. In the state of Massachusetts, they're required to prescribe the generic unless it's medically necessary you have a name brand drug. You can also approach the drug company. I have several clients that have approached the drug companies at the cost, and they've managed to get some relief from the drug company. But there's no hard and fast rule that says, if you do this, then that will happen. Okay. There was a question back over here. Yes, ma'am.
On the Medigap plans, the coverage is the same in every cover.
The coverage is identical. What they cover is the 20% that Medicare does not cover. The cost difference can be predicated on what they offer as an additional benefit. But they all cover, whatever procedure Medicare covers, the Medigap plan will cover. Case in point, they don't cover cosmetics. Medicare does not cover cosmetic surgery, okay? You go into the doctor and say, I want to have some cosmetic surgery, you pay for it. Medicare won't cover it at all, unless it's as a result of an accident or a medical need.
I'm on Blue Cross Blue Shield bronze. What is that in this Medicare?
I think that's the supplement. That's the supplement one. You can figure out your premium, figure out which one is. I don't happen to know them all by heart because there's so many. So what you're paying for is the deductible of either A or B or A and B as extra money, but the coverage is identical.
Premiums vary widely.
I'm sorry?
The premiums vary widely from company to company.
Yes, they do. Yes, they do. And that's the company's choice to put that premium out there. Okay. There are some very affordable ones on there. There's some ones that are more money, and it's up to you to decide which way you want to go. But the coverage is the same. They all cover the same thing. They cover the 20% that Medicare doesn't. Some cover deductibles. Some might give you physical fitness. You know, you have to read the plan. What I encourage clients to do is, if you're indifferent as to which two plans to select, call the company and say, hey, which is which? Medigap Insurance, like I said earlier, is open season all year long. You can change the plan, call them up, and it's effective the first of the following month. Okay? Medicare Advantage, you sign up for a new plan during open enrollment. During January 1st and March 31st, that's another open enrollment period for Medicare Advantage. If you don't like the plan you're in, or you want to change plans, or you want to opt out of it, that's when you do that. January 1st through March 31st, that's Advantage open enrollment. That's the only time this open season, and that January 1st through March 31st is the only time you can change your Medicare Advantage. Come April 1st, you're stuck for the rest of the year in the Advantage network. Yes?
Is the monthly premium negotiable?
No. For Part B?
Yeah.
For Part B?
Yeah.
No. The only thing that you're going to negotiate a Part B on is you retired December 31st this year, and I'm going to say you're married and your income is $200,000 a year. So you're automatically in a higher bracket. So when you sign up for Part B, Social Security, who runs it, looks back 2 years prior. So whatever your income was 2 years to the date that you retired, premium is going to be based on that amount. So as you progress into your retirement and your income goes down, your Part B payment will go down to the base of $148.50, what it is today. What it's going to be in January, we don't know yet. Okay? Yes, ma'am.
Regarding a primary care provider, is it true that if you have a Medigap program, you don't need one, whereas you need to follow the primary care provider can recommend or Advantage plan?
It's up to the insurance company of the Medigap plan. But in Medigap, as in Medicare, you do not need a referral. Whether you need a PCP is up to the plan. I don't believe in Medicare you need a PCP. You go wherever you want. That's your freedom. But you want to check with not just Medicare, but the insurance, the 20% insurance company. But I know you have the freedom to go wherever you want. Any provider that takes Medicare in the United States will take that Medigap plan, whichever one of the 7 you choose. Yes?
On the deductibles on the Medicare Advantage plan on drugs, you have to pay up to that total before you know what I mean, it goes over. How does that work?
So you're talking about the deductibles on the prescription drug plans?
On Advantage, yeah.
Okay. The way deductibles work on the Advantage plans for drugs, they do not count against the deductible for the Medicare Advantage plan. Okay? So if your Advantage plan says the deductible is $6,000, your drugs do not count against that. It's only your hospitalizations and your dealings with physicians. So if you have an MRI and you pay $325, it goes against the deductible.
So this is RX deductible $195. You have to pay that first.
That's just for the drugs only.
So you pay that.
No. It depends on the drug that you buy. If it's tier 1 or tier 2 drugs, they don't even count toward the deductible. So you can get all the tier 1 and tier 2 drugs you want, and it doesn't count against the deductible. Deductible only kicks in at tiers 3, 4, and 5.
So a tier 3 drug, say it's $400. And how does say the deductible is $195?
Then you've already satisfied your deductible for that year, and you'll get the lower rate next time. Okay? Anybody else? Come on, this is too easy. Give me some hard stuff. Okay, well, yes, ma'am.
I have another question.
Sure.
On the Part D,
Yep.
It looks like a lot of them went up on their monthly premiums. Is there a reason for that, or have you?
Yeah.
Other than that, I mean,
Other than that, there is no reason.
there is no reason.
I personally had a case several years ago where I did not read the mail that I got when the Part D plan said they were going to increase, and I threw it in the bucket because I thought it was junk. And I ended up getting stuck for the 40% increase that hit me next year, and I was stuck all year long. So be careful, please. Be very careful. Yes?
I switched over to VA, what is Medicare.
Mm-hmm.
And very happy with the services I got. Completely have all procedures but at VA and drugs. Do I need Part B?
You might want to talk to the VA about that. I'm not 100% sure, but before I get it, I would talk to them. So you get everything done at the VA. You do nothing on the outside world. You might have to get it anyway just to avoid a Part B penalty.
A what?
A Part B penalty.
What's that?
That is based on a dollar amount the federal government publishes. It's about 30 cents a day, times the number of months, times the number of years. So, yeah. You could also talk to the Veteran Service Officer here. They're very well versed in that.
Okay.
Yes?
Quick question, do any plans cover you out of the country?
Ah, excellent question. Okay, Medicare doesn't work outside the United States, period. Medigap plans and Advantage plans will cover you outside the United States for, get this, life-threatening emergencies. I have no idea what that means. Okay? I just came back from Europe, and my wife and I bought supplemental insurance because there was a possibility if we tested positive for COVID, we were on a river cruise and kicked off the boat and have to get into a hotel and quarantine. This policy covered the hotel cost. Okay? Whether you want secondary insurance, travel insurance is up to you, but
Where did you get the travel insurance from, like a credit card or something?
the way it works is you would go to a medical facility in the country that you're in, you pay, and then you get all the documentation in English sent to you, and then you could submit that to your secondary insurance carrier and see what they cover. If you have travel insurance, you'll exactly see what the policy will cover. The fact of the matter is, you pay up front, and then you go and file for reimbursement when you come home. Anybody else? Yes?
Can you go over the open enrollment periods again? I know up till December 7th, you said you can change Part D and your Advantage plan.
So
is that it?
open enrollment is October 15th through December 7th. And that's if you have a Part D Delta drug plan and you want to see if you can do better, that's when you do it. And if you have a Medicare Advantage plan and you say, I don't want this plan, I want a new plan, that's when you sign up for either of those. January 1st through March 31st is if you have a Medicare Advantage plan and you want to change it, go to another one, get out of it completely, that's when you do that. So you have Medicare Advantage, you have two options, two chances to change. Part D, you have to do it now. If you don't do it by December 7th, you're going to stay under the same program. That's not to mean you shouldn't, but you should have us do a drug search for you just so you make sure. Now, when I do drug searches for clients, I highly recommend that they also call the company, the drug plan, to verify the numbers. Okay? Because these things can change without us knowing. Anybody else? Yes, Mary?
This might sound like a silly question, but people have asked me at the front desk. There's a Part A, there's a Part B, and there's a Part D. Is there a Part C?
Part C is Medicare Advantage. But we refer to A, B, and D because those are the biggies. Part C is Advantage and Medigap. Yeah, we got rid of it. We don't like it. Understand one thing, ladies and gentlemen. Medicare, the way it's managed in each state, the way they manage the supplemental and the Advantage plans is state-derived. So what's good in Massachusetts may not be any good in Ohio, Wyoming, wherever. So I've had clients say, well, I have a friend in Colorado and she said I should do this. Well, that's fine if you live in Colorado. If you live in Massachusetts, you do this. Okay? Massachusetts has a wide range of mass health plans for those that are financially needed for that, and we can help you navigate through that. It's a very extensive process, but we're trained on helping you to get through that if you want that. But like I said, for Part A and Part B, you can sign up before you're 65 or when your medical coverage ends, either through your own employer or through your spouse. Yes.
What's so important
Oh.
about the zip code? When
Okay.
these guys advertise, they tell you they're gonna give you the world, but you gotta be in such and such zip
Okay,
code area.
good question. Medicare Advantage plans, if you look at your handout, the last half a dozen sheets, Medicare Advantage plans are county derived. So if you look at a plan and it doesn't have Norfolk County in it, you can't get it. That's what the zip code is for. So you're not going to sign up for a plan in Worcester because you can't get it. I'm sorry, the gentleman up the back had a question? Nope. You had a question?
I received my Medicare A and B cards in the mail recently.
Yep.
I don't turn 65 till next year. Do we still have to sign up or?
I used this. See me afterwards, please.
Okay.
Yes.
Is there a webpage you can get all this information to from the government?
Yeah, it's called Medicare.gov, not COM, Medicare.gov. Now, if you're adventuresome and you want to have some fun with the Medicare website, you can do your own Part D plan search and a Advantage plan search. It's easier if I do it, but if you want to play around with it. Now, another thing that we highly encourage our clients to do is open a My Medicare account. So you go on Medicare.gov and you say open an account. And they're going to want your name, address, zip code, your Medicare number. And you're going to give it a username and a password, and you just follow the requirements. What that does, when you come to see us, I'll say, what's your My Medicare account? You give that to me, and I can pull up all the drugs that you take. So I have a client with 15 drugs. I don't want to type in 15 drugs. And you're on your 45-minute time with me. You don't want me to type in 15 drugs. Get a mymedicare.gov account. That'll do two things. I can pull your drugs up quickly. You can do the same thing. Plus, when you use Medicare, you can track the charges right against it. You'll see what they billed you for. Okay?
Can you give that on again? Medicare?
Medicare.gov,
Okay.
not COM, G-O-V. There is a Medicare.com, but you don't want to go there.
Is it Medicare.gov or MyMedicare?
Medicare.gov you can set up a My Medicare account. When you open the site, if it says law, it'll say, what do you want? MyMedicare.gov. Okay, that's the name of your username and password would be under that. And if you don't already know this, you can do the same thing with Social Security, SSA.gov. You can set up a My Social Security account. And you can review your benefits checks, what you're being billed for. Okay, you can do the same thing. But My Medicare account is a very, very good thing to have. Any other questions? Well, you're letting me out of here too easy. All right. How many of you do you think you might want to come in and have a Part D drug search done? Okay. If you just want a Part D drug search done, see that lovely lady up back, Terry? She's my boss. She's my boss. I call her boss. She will give you a form to fill out. And one of the things it'll ask you is, do you have a My Medicare account? If you don't, that's okay. You can give me permission and I will establish one for you. And then I can pull your drugs and get them that way. Or on the back page, there's a listing for you to put all your prescription drugs down. Now, if all you take is pills, atorvastatin, 20 milligrams, one a day, I can figure that out. But if you take eye drops, insulin, salves, ointments, anything that's a liquid, I need to know the size of the container, 10 milliliters, 10 micrograms, and the number of containers you take a month. I don't care that you use 5 drops a day or have 2 shots of insulin. That's not my want. I need to know how many of that container you take. Then I can get you an accurate drug cost. So you can make an appointment to see me. I will be here again, I think it's November 4th. I do 45 minutes appointments. You can come in, or to expedite that, you can get the form from Terry, give it to her, she emails it to me, and I fill it out, and I have it mailed back to you. Yes, ma'am.
You have to be a resident
No. You can go to any senior center you want. I also work in Hingham.
No, but I could come to Braintree if I want.
You can call Terry right here and she'll make an appointment. Or if there's no appointments here, you can go to Weymouth, you can go to Braintree, you can go to Hull, you can go wherever you want. You can go wherever you want. Okay? Was another question back here? Yes?
When will the actual rates come out?
Now she just stumped me. They're coming out very slowly. This is very frustrating for us Shine counselors because we do these open enrollment sessions, and we don't know. Typically, we have some information, but not enough to get to the general public. So you can go on the Medicare, on the Medicare.gov site and see what they say, but they don't even have the new Part A and Part B numbers out yet. So I wish I had better information for you, but that's the one that we kind of like, don't like that one. Anybody else? Terry's busily giving out paperwork. When you fill this form out, please fill it out completely. It will ask you, do you have a Medigap plan? Which one you have? Do you currently have a Part D plan or an Advantage plan? The more information I have, the better I can do the drug search for you. Yes?
So I turned 65 and I signed up for Part A only because I'm getting insurance through my employer. Will that hurt me in the long run?
No. No. A is free, like I said, as long as you've worked 40 quarters, Social Security, 10 years. The only thing you want to be careful of, as I said, is if you have an HSA, health savings account, that you could suffer tax implications. Otherwise, as long as A doesn't cost you, as I said before, don't listen to your friend that says, well, when you turn 65, you got to sign up for Part A. Unless you're disabled, you're automatically going to be signed up for it. Otherwise, you don't need to. And if you're federal, state, or retired military, be careful.
So if I had to go to the hospital, would I use my insurance now, or would I use?
You'd use your insurance. No. Anybody else? Yes?
Just had a quick question. How did we go from Advantage program that we got on, they're going into Tufts now?
Yeah, they merged.
They merged into Tufts, and the Tufts doesn't have like premium or anything.
There are Medicare Advantage plans out there that are $0 per month. And they also have, the same provider has them for a premium per month. What the difference in those plans is the amount of your deductible, basically, and some prescription drug costs. And again, it determines which one you take based on your personal needs. Okay? Yes, ma'am.
Barbara here has a great question. She is under her husband's employee health group plan, but she is eligible for Medicare on her own, and she has expensive eye surgery coming up. Would she be better off going with Medicare and getting the benefits from Medicare, or staying under her husband's health insurance and paying her?
You have to do the analysis between the two. So what does your plan cover, or what does his plan cover for your benefit versus Medicare? That's something that you have to do. How far away from 60, are you eligible for Medicare? Okay.
I'm on his insurance, but they don't, I've been, like 5 times as many. Sometimes it's like $3,000, sometimes it's like $1,500, but they don't pay anything. I had to pay it all myself, and I had to go around asking my relatives to help me pay for it.
Yeah, unfortunately, that's something that I can't tell you which is the best. What we tell clients is you have to do the analysis. So sounds like you've said it's going to cost you $1,000 to have this procedure outside of what his insurance covers. So Medicare you're going to pay for. You're going to pay at least $148.50 a month, plus a Part D prescription drug plan, plus a Medigap plan if you go that way, or a Medicare Advantage plan. And what those plans cover is different. So there's no easy answer to it, I'm sorry.
Does she get coverage from the husband's health insurance plan after Medicare would pay their piece? Would she be able to kind of?
If she did, yeah, if he had private insurance, there's a chart that's called Who Pays First. It depends on where you are in that. Your husband's plan would pay first, Medicare could pay second, but you need to check with his insurance company to find out what they do. Again, there's no,
They hardly pay anything, they paid like, it was $3,000, his insurance only paid $30, and I paid the rest. Yeah.
then you might be better off going under Medicare completely and getting out of his insurance policy. That's, again, there's no easy answer to it. I wish there were. Anybody else? All right. Okay. So, as I said, if you want to come and see me for an appointment, talk to Terry. If you want a drug search done, fill the paperwork out, get it to her, and she'll give it to you. I'm not doing drug searches until at least the end of October because the tool that's in Medicare, it's called the Plan Finder. It is still changing, so if I do a search in the morning, it might be different in the afternoon. So I'm waiting for a while. So even if you put the papers in today, I'll get them, but I'm going to sit on them for another week or two until things stabilize. As far as next year's prices, if you go on Medicare.gov, you can see what A and B is going to be. You can see the deductibles. As far as the Advantage plans, you can look at that. If they're a zero plan, they might still be zero. If they have a premium, I would say my own guess, and this is not official information, $5 or $6 might be the upkit. Okay.
And I'm gonna need your schedule, because I don't have a schedule here.
What's that?
I need your schedule, so people want.
Oh, yeah, okay. All right, well, first of all, I want to thank everyone for coming. I want to thank Braintree Senior Center and Wes and Martha for presenting this on BCAM. And if you want to come up and chat with me, I've got about a half an hour. I can hang around. Otherwise, have a very pleasant Halloween and Thanksgiving and Christmas. Thank you.